keynote lectures. First would be by Dr. Rohit SHETTY sir on what modern fellows could pick up in fellowship.
The onset, like to thank the AIOS, Dr. Meenakshi, and the team for this opportunity to give a insight into how to excel in fellowship, but this is more from a perspective of the teachers also. So my financial interests and no direct link to today's talk. So when I talk to my residents or I give a give an insight into how they have to look at their fellowship, I use this acronym which I call See and Evolve. The first thing about the word see is about the clarity. One of the most important things today among the residents is a lack of clarity what they want to do, and the clarity starts as soon as you face an interview. When you're sitting with an interview, they give you an answers like I am interested in cornea, but I want to do retina, I want to do medical retina, I want to do this. I mean, no harm in doing it. I mean, there are a lot of us have been trained to do everything in ophthalmology, but the time and generation is different now. And so you know that the clarity of thoughts, and that's completely missing. The second is about the, I mean, I use this painting very often in my practice. It's about the most famous painting by Luke Fields in 1870s or 1880s. So it talks about the passion and empathy of a doctor. So one of the most important thing when a fellow or a resident is trying to take up something interesting, a big challenge which happens is the word here, the Hindi, log kya kahenge, kill more dreams than anything in the world. That means that what will people say has probably the biggest impact in our entire process of learning. And this is something which is very important to imbibe in our students, that you have to forget about the world and their opinions. And I usually show them this kind of articles. The effect of having Christmas, and this is a very important journal with in-laws. But if you really look at the journal, and being a cell biologist myself, your mood can affect the microbiome. The microbiome can affect your mood. The paper looks quite funny, but it's not too funny in the scientific domain. So you have to tell them, you have to come out with these kind of things. You shouldn't be shy about talking about this or publishing this. This is what is very important, both from a clinician as a teacher, because we have discussed about beautiful postgraduate. I mean, it's the best time to be a postgraduate with kind of a platform sir has created. But we have to look at what the fellows and the next generation comes. We have to motivate them to be the best. This is in one of my teaching rooms, and this is what I keep, because everybody has a preset idea that this is not there in PubMed, this is not there in scientific. When I ask them a question, which is very radically different, the first thing they tell me is, you know, sir, it's not there in the PubMed. Then I tell, does it mean that it does not exist? And we are always done this way is probably the most dangerous thing. And this is one thing we have to take it out from the residents. And I make them all read this book. This is very important because this is a decision making. It's just not for their the clinical work. It also has a huge impact in their psychosocial environment they are in. They have to be very good with the experience. We have to teach them that every small thing, your first rexus, your first lifting a flap, your first one small case, they have to enjoy that experiences. And these experiences are missing today. Most of the experiences are that I win Rangachari, only then for me it's a great thing, or I win a ASCRS award. So small joys is the job of the teacher is to make them experience. So every time we tell them, oh, you did something different today, let's celebrate. So it's very important to bring that out. And I tell them, when you go to a conference, don't mingle with the same team, same people, because you don't learn anything. You go to, see, if I'm a cornea surgeon, if I go to an Orbit, oculoplasty, or some other branch, when I go back to my clinic, probably I can apply something from a retina. I was speaking to Dr. Dhanashree ma'am outside. She's saying, oh, we work on losartan as an antifibrotic. She was telling me, can we start looking at it in retina? Can we start looking at an animal model in retina? That means that when two people talk from a different branch, you start thinking differently. But unfortunately, we all huddle together. We all go to the same hall, same meetings. And this applies to science. This applies to scientists. Because the future of medicine is not going to be the same as what is it today. 25 years back, Dr. SHETTY told me that your future of medicine is not an extension of your past. So if you want to be in the future, you have to assume that this is going to be outdated. This is all. I will skip a few things. You have to make students show active interest in science. We cannot just tell them that today scientists, clinician scientists, there's a huge need of them in our practice. And institutes like us, bigger institutes, should encourage them to be part of a scientific discovery. When it comes to visualization, millions saw apple fall, only Newton asked why. The question of asking can only come when you start going to the scientists. I think Arvind, Shankar Netralaya, LB Prasad, all of us have fantastic science labs, because the next generation of clinicians should be driven by science. Skill is now become very easy. If you look at the postgraduates, very quickly, because of the gaming and all that, they're dexterous. They're very dexterous in their approach. They no longer struggle with, there's no dominant and non-dominant hand anymore today. But what is important is the power of how you bring them to science. You should create mentors for them to visualize. It's just shadow surgeons, decisions, how the thought process works. And we need better mentors, and we have, every time I'm operating or talking to my patients, we have to be aware that somebody is watching me, because the child will follow the parent, the student will follow the mentor. There's a very famous story in Buddhism. Once Gautam Buddha goes to a king and he says, you're a magician of many things. You can create magic. I bought a horse from Iran. The horse is limping and it's not running. And Gautam Buddha said, I can't do magic. He says, please have a look. So Buddha went and saw the horse. It was limping. It would not move forward. Then he comes back and tells the king, the first thing you do is change the trainer. He said, what has trainer to do with the horse? Is he hitting this horse? He says, no, your trainer has one leg, but the horse thinks that you have to run with one leg, the front leg. So it is just always that it is so powerful that you have to follow this. And these things have already been said, so I will not go into this thing. Outcome measurement is very important. Videos, logbooks. There are a lot of softwares today which helps to improvise. There has to be like how we all have NABH, and every 4 months we analyze the KPI, key performance indicators. We need to bring that into our training. And we have to make them understand that their journey is different from the others who put different things on the Facebook. Somebody says, I did the first smile surgery and you have not even done. You start, that day I see them going tremendously low on confidence. The person might have done something totally different. So as mentors, as teachers, we have to bring in focus about how you enjoy the journey. And that is what I keep telling them. Every small thing is important. And this is a very, very difficult thing to do in today's generation. We have to experience them. When they don't see it, they think it does not exist. So I push them into therapies, which is cutting edge today, because tomorrow's ophthalmologists will be doing all this. And this is going to be in the next few years. And we have to make them understand. But to make them understand, science is not for publications or getting promotions. Science is reality. The science is going to be part of your clinics. And most important thing is to understand what is an etiquette of being in the social media. Do you post everything? How much do you post? For example, sometimes they show the patient. And there was one post which I found very offensive, which I wrote to that person. I said, a typical housewife wanting some surgery. I did not use. I mean, it's so offensive as a post because nobody has told that person. In today's context, you can't write all that nonsense. So we have to be, as mentors, we have to know what is a right way of posting. And if we are posting something terribly wrong, they will also do the same thing. And evaluate every time. You evaluate yourself as a mentor, you evaluate themselves, and all the time you see, when you see them, the best denominator is when you see them after 3 or 4 years, you look at them and say, are they mirroring myself or twinning myself in my work, principles, thought process, etiquettes? And if they're not, that means there's something you're doing something wrong. It's something you have to evaluate yourself. Last few slides, tell them to focus on mysteries. That is where the whole journey is going to be interesting. Push them to ask silly questions. There's nothing silly. The most silly questions are the ones who probably won Nobel Prizes. Polish your mind with mind of others. Keep reading, because when you read, you'll probably get better with your students. And all that I have already said. I thank the society for giving me this chance. Thank you.